Learn about a program at South Oaks Hospital that is offering a new level of behavioral health care for families. And Nancy Hemmendinger from Suffolk County's Office of Health Education joins us to discuss eating disorder.
For example, the Youth Risk Behavior Survey 2013, we have 16.6% of our youth are actually obese, they're overweight. However, 30% believe that they're overweight and 48% are on diets.
And we revisit the segment on the Red Watch Band program. Hello, I'm Art Flesher from Suffolk County Health Department's Division of Community Mental Hygiene. I'm your host for Something of Substance, our monthly video magazine. Welcome back. Each month, we show how substance abuse, mental illness, and developmental delays affect you, your kids, and your community. We'll also give you a few examples of how services in Suffolk County help people find the inner resources they need to tackle their problems.
Where's Mom? Did she forget me? I wonder what happened to her. What if I get left here?
Drugs and alcohol may make you forget your problems for a moment, but that's not all you forget.
My mother worked hard to be in recovery, and I love her for that.
The Comprehensive Outpatient Behavioral Services, or COBS, is a unique behavioral health program at North Shore LIJ South Oaks Hospital. This outpatient service provides a holistic treatment approach to children, adolescents, and their families dealing with mental health and substance abuse issues.
COBS stands for Comprehensive Outpatient Behavioral Services, and it was designed in order to try to provide a unified service area for patients who have mental health needs.
The mission in COBS is really to serve as many children as we can in both Suffolk and Nassau County. Children come to us with psychiatric illnesses, and our goal really is to stabilize not only with medications, but through group therapy, family therapy, and individual. The unique mission that we have is to do this in the home. So we actually visit the homes of all the patients who come into our clinic.
We provide therapeutic services for the children and their families, as well as medication management. We do case management working with the schools in order to help families stay together.
There's a large community of children and adolescents who need both therapy as well as medication management, diagnostic evaluations, school consultation, really working with families, with schools, with the patients themselves, and with outside support systems to try to deliver comprehensive care to our patients. And that's really what our goal is to give them the most comprehensive care that we can.
So my role here as the director is to help ensure the daily functioning and operations of the clinic. I provide supervision to all the counselors. I work with the families as well when there are problems. I also work with inpatient and our partial hospitals in order to assure smooth transitioning through the entire service line at our hospital. I work on budgetary things and program development for the department.
Our intake and evaluation process is done with an extensive set of questions to get an understanding of the individual's history, the family's history, and the presenting concerns so that we can find out the best ways to help them moving forward.
My role as the administrative director of COBS is to really provide a seamless garment of services between our inpatient services, our partial hospitalization, and our outpatient. So by overseeing all three programs at South Oaks Hospital, I'm able to assure that any patient that gets admitted inpatient will have their services fulfilled and seen through the outpatient services, And there's a warm handoff so that the patient is not coming into a clinic for the first time, not knowing anybody, but they've actually met their caseworker. They've participated in their discharge plan in the hospital, so that when they come to the clinic for the first time or meet their counselor in their home for the first time, they have a recognizable face.
We were designed really to take patients who might not have been able to afford to go to a private facility. So we are a clinic, and what we do is we take patients in here who need therapy but may also need medication management, and we work as a team. We don't believe that you can have something, just have medicine as the solution. We really believe that it should be a comprehensive approach to treating each patient and their families.
Well, I work with both children and adolescents that deal with dual diagnosis. That's both substance abuse and mental health.
So when someone wants to become a patient at Cobb's, they can either be referred by the hospital, any hospital really, a school, or on their own if they look us up in any kind of resource book. The process would be that they would call our main number, 608-5900. They would be set up with an initial intake where they would come in with a family member, a parent, guardian. They would come for an evaluation where we would do about an hour and a half assessment, where the clinician will go through a history, take a psychosocial, and determine what the family's needs are. After which we would review the case, assign it to the appropriate counselor, and determine whether or not services would be provided in their home or here on site. And then once they become a patient, we determine the need for psychiatric services if they are needed, at which time we would then have a psychiatric evaluation done.
So when they initially come in, they meet with a social worker like myself or another mental health counselor, and they do an extensive group of questions to kind of get a good background of their history, family history, what kind of the current concerns are, and we kind of get a good idea of how we can help them moving forward.
Our youth the age group is anywhere from birth, if you will. We have a perinatal clinic all the way to 21 years of age. And people that come to us have different diagnoses. Some have mood disorders and others have chemical dependency disorders, and some have a mixture of both. A lot of the children that come to us and the adolescents have problems in the community and problems in school, problems at home. And usually through the medication that we provide, we're able to stabilize the symptoms of their various diagnoses. But once again, working with the community, working with the family, we're able to return that person to a productive life in the community.
Some of the groups here at Cobb's are diversity group, a coping skills group, a healthy decisions group, a social skills for exceptional teens group, and an in-betweeners group. All these groups, kids come and they can at least talk to other peers about their problems, and it just helps them express themselves when other people have the same or similar problems as they do.
We have some young people that come in with anger and substance abuse issues, and they're really struggling in school, and we've gone into the school as well as into the home and worked with these individuals to try to create the best plan for them. And through that, they've graduated high school and moved on and are going to college successfully with positive relationships and, being abstinent from substances. And so you see this individual progress from a place where they, really couldn't function with other people. And now they're in a place where they're really thriving and have matured and gained a lot from working with us as well as working on themselves.
Primarily what we're seeing is a lot of suicidal, parasuicidal kids, a lot of children who engage in self-injurious behaviors. We're also seeing a lot of school refusal kids, so we work with the families to get these children back into school. We've started a DBT kind of group where we work on skills trainings for these kids to help them stay safe. We also work very closely with their schools, their pediatricians, and any other people in their lives so that we can be sure that there's consistency in their life throughout, and that we can help them best both at home and here.
We'd like to thank all of the South Oaks staff for giving their time to us and for offering the COBS program as a valuable resource to our community. For more information about the COBS program, please visit the South Oaks website or contact them at area code 631-608-5900. We'll be right back.
Who else has been taking your prescriptions? Keep your medicine and your family safe and secure. Mind your meds. To learn how, visit the partnership at drugfree.org.
I had no idea seems to be a common response when we hear about someone seeking help for an eating disorder. Eating disorders are real, complex, and devastating conditions that can have serious consequences for health, productivity, and relationships. Nancy Hemmendinger, the Director of School Health Education for Suffolk County Department of Health Services, joins us to discuss this potentially life-threatening disorder. Nancy, thank you so much for joining us.
Thank you for asking me.
Great. I guess the best place to start is maybe you can talk about what is an eating disorder?
Eating disorder is an unhealthy way to cope with somebody's environment. It's an unhealthy coping skill. It's a set of diseases. It could be anorexia nervosa, bulimia, or binge eating disorder. Anorexia is when somebody is not taking in enough nutrition to maintain their weight and maintain daily living. Bulimia is using food to numb out their feelings and then compensating by use of laxatives or vomiting or over-exercising. And then binge eating disorder, similar to bulimia, is taking in large quantities of food to numb out, again, not having to deal with feelings. When people think about eating disorders, Art, they think about eating and food,
Right.
but that's the tip of the iceberg. Eating disorders, really, it's everything that's underneath the water, underneath the tip of the iceberg.
Yeah, it is a very complex issue. Are there other health problems that tend to go along with eating disorders?
Yes, for example, osteoporosis, depression, anxiety, heart attacks, suicide are all part of the things that go along when somebody has an eating disorder. And that's why catching the eating disorder or being aware of the signs early on and getting somebody help early on is so important. Prevention is even better, but being aware of the signs for early treatment.
We'll talk about that a little bit, that whole idea of early intervention. Do you think that occurs often, not too often, and why do you think that is?
I think for the most part, people don't realize or don't recognize those signs of an eating disorder. Might be somebody who started a diet and they started to lose weight and they're getting lots of compliments.
Yeah.
This person who develops an eating disorder, it's not because they went on a diet. That was the trigger. That was the triggering behavior for them. They had a vulnerability that put them into the full-blown eating disorder. So many times the eating disorder is, they're so into it, has taken over so much of their lives that just to get therapy on an individual basis may not be enough.
That's interesting because you're absolutely correct in saying that many of the signs are actually socially prized, aren't they?
Yes.
That somebody's maybe thin or becoming thinner, they appear to be taking great pride in their health when in actuality their health is deteriorating.
Yes. For example, somebody with an eating disorder, anorexia, for example, some of the characteristics are perfectionism, well-mannered, social anxiety. So this is, say, a student in a classroom that's sitting there and they're the perfect student, and they're not going to get the attention. They'll be wasting away in that classroom until they're so sick that they are not able to go to school anymore. And our culture certainly promotes this idea of thinness. At the same time, we have the public health community who we're trying to improve the dietary and physical activity patterns of people because we need to do that. but we're doing it in a way sometimes that are triggering people who have a vulnerability that we may not have seen 30 years ago.
Right.
For example, the Youth Risk Behavior Survey, 2013, we have 16.6% of our youth are actually obese, they're overweight. However, 30% believe that they're overweight, and 48% are on diets.
Wow.
And then we have 1 in 5 high school girls who are not eating 24 hours or more to either lose weight or not to gain weight. So that is our environment, our culture, that is putting people who are vulnerable, have this genetic, psychological vulnerability, and putting them at risk, actually triggering their behavior.
So much of it has to do with body image as well. You know, as you're saying, the sense of only 16 some odd percent are actually classified as really having a weight problem, and such a much larger percentage think they do.
Yes.
And how do we counteract that? What kinds of efforts are going on to kind of try to address that?
Well, I think we, in the public health field, we need to use our language, and that language would be, we need to improve our dietary and physical activity patterns by fueling our body and by strengthening our body with physical activity, as opposed to using the diet industry's language, you know, losing weight, diet in itself, just using that word. Taking the focus from external and putting it internal, having our young people focusing on developing themselves inside and trying to get the focus on the outside to be less important.
And language is really important, isn't it?
Yes.
Go ahead.
Somebody who has an eating disorder, one of the things when they are in recovery, even to say to somebody, oh, wow, you look healthy, that can be triggering. For them, that gets turned into, I'm fat. Even, oh, you look so beautiful, I'm fat. So for me, I'm very careful about communicating things about how people look. Even in an office situation, somebody loses weight, and typically they receive compliments. Oh, you look great, you lost weight.
Sure.
What I try to focus on is, how do you feel?
Right.
To me, that's the health, behavior health piece that we need to focus on. Not the look, but how you feel.
Nancy, I'm sure as many of our viewers are watching this, they're thinking about family members or other people they may know that may in fact have eating disorders, or they're concerned about them. How might they find out more information?
I would recommend that they contact the National Eating Disorders Association. They have a wonderful website. It has parent toolkits, teacher toolkits. They have information for practitioners, medical doctors, how to speak with somebody who has an eating disorder, how to get support, the importance of self-care. And I would also recommend on that website, or you could just go to mybodyscreening.org, and then you can give yourself a self-screening, and that will also lead you to the National Eating Disorders website. They also can contact me at 853-3162, and I'll certainly talk with them. We have, through the NEDA, National Eating Disorder Association, they have NEDA navigators to help people navigate the system.
That's great.
Yeah.
Glad to hear that. Thank you so much for joining us. Up next, we revisit our segment on the Red Watch Band program. Stay tuned.
They'll be fine, I hope.
What if you could prevent a young person from getting hurt or killed?
What should I do?
If you could turn back the clock and stop an underage drinking party from ever happening. Now you can. Pick up the phone and call 1-866-UNDER-21. It's your community, your call, and it's completely anonymous.
Far too many students lose their lives each year to alcohol-related deaths on college campuses. The Red Watch Band, Stony Brook University's response to this alarming problem, trains students to prevent these tragic fatalities.
The Red Watch Band program actually evolved out of a tragedy of one of our faculty members. Last year, one of our faculty members lost her son as a college freshman due to alcohol poisoning. And so the president of the university at the time reached out to her and said, how can we help? What can we do? So they got a team together with the president and the dean of students office and the alcohol and drug professionals and mental health professionals on campus. We all got together and put together the Red Watch Band program. And so what that is it's a comprehensive bystander intervention program designed to prevent death from toxic drinking.
Well, additionally, I just wanted to add more knowledge to the base that I have already, because I heard about it through RA training. They already gave us a lot of basic things that we do need to deal with certain situations that we'd run into. So I just wanted to get more information to add to the resources so that when I do approach someone with a problem, that I would know how to handle it properly.
Teaching students how to call 911, when to recognize an alcohol emergency, and how to call 911. And that's really how the whole thing goes. It's about 4 hours to go together. It's a non-mandated program, so we don't make any of our students enroll in the program. We let them know about it, and they sign up on their own accord because they're interested and they want to help a friend.
I'm actually one of the peer health educators through CHOICE, which is choosing healthy options in a campus environment. We focus mostly on alcohol dependence, drug dependence, and sexual assault and how it interacts. So I'm interning with them this semester along with, I believe we have like 15 students in our class. And this was one of the things that just seems to be very relevant to what we're learning about.
When they have availability, a lot of the students are busy, but when they're available, they come to the trainings and they will work with us in training their fellow peers on how to recognize an alcohol emergency, role playing, and things like that. So.
Well, the role plays were very interesting. One of the biggest things I had mentioned was that you run into a problem where you realistically, when you meet someone, especially on the street, that one where you walked into someone and you've seen them and they had an issue, most of the time it seems like it's the culture that we have in America, where if you see someone and they look like they're in problems, you don't really want to walk up to them because you just don't know how they're going to respond to the help that you're trying to give them. Some people, push you away or may even attack you. So that's one of the strangest things, helping people that you don't really know. So the only way you really get to do it is through practice and role playing. So, that's mostly what I really wanted to get, a little bit of practice in talking to people that you may not necessarily know.
The CPR is an integral part because what the CPR does is it teaches us how to recognize an alcohol-related emergency, and a lot of students don't know that. We don't want students to be performing CPR on all their drunk friends. That's not the intent of the CPR, but it is to recognize what is an alcohol-related emergency, what is a regular emergency. One of the examples I use when I talk to students about this is, if you were in your class and your classmate passed out, you would recognize right away that that was an emergency and you would call 911. When people are intoxicated, we don't perceive those as emergencies, but they are. Anybody who's passed out and unconscious is an emergency whether they've been drinking or not. And the CPR goes through steps on how do you recognize emergency, how do you call for help, and so that's why it's been an integral part of the program.
And the scenarios that they played out, the role play, it just gave me a better level of understanding of how I would respond in that situation.
A lot of students have been in that situation where they've been at a party where their friend has passed out and they felt helpless and didn't know what to do, and so they want to help their friends and they don't want to see their friends get hurt or die, like what happened to, it actually happens to 1,825 college students every year die from alcohol poisoning and alcohol-related injuries associated with alcohol poisoning. So it's definitely a problem, and the students know it as well, so.
I think just the skills to know when a situation's going wrong. Like they were talking about, you have that instinct, but sometimes it's hard to act on it. But when you have an informational background like this, like you've seen it acted out before you, you have people who have had experience in this telling you, no, this is true, you're right, act on it. Sometimes it's a little bit more reassuring when you are in a situation, you know that you can think back and go, oh wait, no, you have almost a justification for it. You're like, oh wait, I remember learning about this. It's not me just thinking something's wrong.
No, there are 1,825 college students that die from alcohol poisoning, alcohol-related injuries every year. And they are students that are at parties and there are people around them and people aren't making those calls. So that's why we want to encourage you guys to make those calls and learn how to make those calls.
Being an RA, you kind of have that already set aside. You have to do things that people don't like from the beginning. So I'm kind of used to it at this point, you know, telling people to cut the parties, or you kind of already are in a position where people don't want you doing the right thing. And I think through practice, it kind of boils down to when you approach someone, you just got to do the right thing. You know, you really can't think about what everyone else is thinking at the moment. Someone could die over it, and if you don't do it, you will know. You know, the newspapers might not know, or the other friends might not know, but you will know that you didn't do it and that person died because of you. So.
The kids that volunteer for the program, they're usually students that are caretakers and then want to help out. They're usually responsible and look out for one another. They're usually just good-hearted students that are looking to look out for one another, that kind of respond to the program and want to find a way that they can help.
I was sitting here thinking that this probably should be mandatory for some of the RAs, at least for the, you know, for the whole part, especially for the whole thing. They had the AAD training at the beginning for the hard things, most of the stuff that we don't know. I think that this is big for everyone on campus, but at least for the RAs, to be able to get some of that practice doing it.
It is a new program. It started in March of last year, and to date we've had 120 students trained, including this new batch, which is about 130 as of today. And we have surveys that we've generated to ask them. And so some of the feedback, in that feedback that we got from the initial group, 40% of students said that they've called 911 for an alcohol-related emergency since the time of the training. I think what we found here is the missing link to in the prevention program, because you know, students have learned prevention from little. I have children in elementary school, and they've come home with the dangers of drinking, the dangers of drug use, and they know the information. It's just not playing out in their everyday lives, in their environments. And this program meets them where they live, and it's on the spectrum. So, you know, we have a big prevention program. We talk about abstinence and prevention and behaviors that are risky and not to engage in. But what do you do once they've engaged in those behaviors? And this program targets that. It gives students tools that they can use that are practical to them. And this is a death prevention program.
For more information about the Red Watch Band program, they can be contacted at area code 631-632-6729. We'd like to thank our viewers for tuning in to Something of Substance. Our video magazine is a public resource, and we're eager to hear your feedback as well as any suggestions you may have for future show topics. For all inquiries and concerns, please contact me at art.flesher@suffolkcountynY.gov. I'm your host, Art Flesher. Join us again next month for more of Something of Substance.